Welcome everyone to the Starting Point Education Channel's podcast. Tonight, we're really thrilled to have Barbara Faracchio. Barbara, please.
Faracchio.
Okay, it's that. And we're so happy to have Barbara talk to us tonight about compassion fatigue. I am Loretta Depka. You have probably visited us on our Starting Point YouTube channel where there's other topics available like eating disorders, anger management, various topics that you should take a few minutes and visit. You can get there easily by the Starting Point Inc. of New Jersey website. If anybody that is joining us tonight has questions, feel free to put them in the chat. If we have time, we will certainly ask them of Barbara. Mm-hmm. We're really pleased to have Barbara with us at the Starting Point. She actually started with us years ago as a intern and now has joined us practicing. She also has a few other jobs, but she is a counselor that we all have lots of respect for and understands this topic well. She also, something that all of you need to know is she also does a lot of work with volunteers that rescue animals. So she has a soft spot in her heart for them. Barbara, is there anything else you want to say about your background that you want to share?
No, I think you said it really well. I think I just want to start off with a quote because I think this is important when we're talking about this stuff. It's a quote by Jack Kornfield, and it goes like this: if compassion doesn't include yourself, it's incomplete. And I think that that's important to sort of keep in mind as we talk about these concepts, because part of this, I think, is part of compassion fatigue. A symptom of that is sort of overdoing it and forgetting to give back to ourselves. And I really want to, that's something I really want to, a point I really want to hit home with as we go through all of this. So keep that quote in mind. If compassion doesn't include yourself, it's incomplete.
That's a great quote.
Yeah.
Barbara, and compassion fatigue isn't new. It's not just because of the crisis we just went through, correct?
No. Right.
Okay.
Yeah.
Okay.
Yeah,
so
it's not.
What is it?
So that's a great question. So I looked up the definition of compassion and fatigue separately because I thought that was kind of cool. So compassion in the dictionary, a feeling of deep sympathy and sorrow for another who is stricken by misfortune, accompanied by a strong desire to alleviate that suffering. So it's sort of, if you see a human or an animal suffering in some way, a strong desire to help, and I thought that's compassion in the dictionary. Fatigue in the dictionary is simple: tired, wearied. So when we think about this, compassion, having that strong desire to help people can lead to the fatigue part of where we're overwhelmed and it's overbearing. Other thoughts I sort of had, compassion fatigue, taking on the pain and suffering or stressors of others, preoccupation with another person's trauma or their emotion. So taking on, really kind of taking on these very intense feelings that unfortunately, like when we're talking about this, they're sort of negative in what we're talking about. It's a suffering of something or sadness of somebody, or losing ourselves in another's experience.
When I think about what you just said, I'm thinking about, and I know you don't want this to all be about the pandemic and COVID, but I can't help but think about our nurses and our doctors and our teachers. But, let's just stay with sort of the medical personnel, the tragedy that they've just lived through. And they wouldn't be in that profession if they didn't already have compassion for people. How do you help them?
Well, I think that there's all different kind of ways of looking at this. So I think before we get into how do you help, let's kind of back it up a little bit. You touched upon it a little bit. I just want to define it a little bit more. Who does compassion fatigue affect? And you said doctors, people in the medical, nurses, people in the medical profession, absolutely. Veterinarians, animal and human, volunteer workers, home care workers, even family members. If you're a family member who's taking care of a sick loved one, you can sort of feel this and experience this.
And we forget them all the time.
We forget them all the time. Yeah, I think we do. Yeah. And also something to remember, we all have our own histories and possible traumas and things like that we've experienced. So compassion fatigue can sort of be exacerbated by one's own trauma.
That makes perfect sense.
Yeah. So it can sit with us a little differently than maybe if somebody else who maybe didn't have that particular trauma or particular situation or circumstance.
Sure.
Yeah.
Mm-hmm. And how does that, I guess one thing that you and I had talked about earlier was, how does burnout fit in there? Is that a symptom or part of it?
Yeah, so that's a good question. So burnout, I found simple, I'm horrible at quoting people, but I learned this along the way. I found a simple sort of distinction. So burnout can be defined as sort of like gradual over time, right? So you start to feel burnt out at your job over time, withdrawing from work, withdrawing, not wanting to sort of, kind of maybe feeling a little apathetic towards work, things like that. It's a gradual shift, and it has, it has some overlapping with compassion fatigue. They can overlap, but that's sort of like a distinction. Okay. That's different. Compassion fatigue could be sort of like acute, a sudden onset. And, how we talk about burnout, people are withdrawing. Compassion fatigue, most often people try so the volunteer workers or what have you, try even harder. So to give, if that makes sense. So they want to give even more of themselves, even though they're feeling that way, almost like this urgency, like this work isn't going to be done. I have to do more. Like there's always more to do. Where burnout is more so you kind of wanting to take yourself out of the situation. I felt that was a good distinction, just to sort of keep it simple. And with compassion fatigue also, it can mirror some post-traumatic stress disorder symptoms, like, nightmares, or depending how severe it is, or feeling alert, not being able to sleep, things like that. And it's interpersonal, oftentimes, compassion fatigue. It has like this interpersonal component, obviously, like you're working with people. And so it's connected.
How do you identify these symptoms? So, because sometimes we're tired and sometimes we're weary. And by Friday, I'm weary. I'm sorry. And I don't, so like, and I'm old too, so that doesn't help. So how do we recognize that we've lost that line?
So I think that's a great question. I got some resources off SAMHSA, which is a drug and alcohol. They have a lot of resources for drug and alcohol, but they have other resources as well. And they sort of define signs of compassion fatigue. So I'm just going to read them because I don't have them all memorized. But reduced feeling of sympathy or empathy, dreading working or taking care of another, feeling overwhelmed by obligations, feelings of irritability, anger, anxiety. That's something to really pay attention to. That we all feel irritable maybe sometimes or anxious, but it's at a higher degree, and it's maybe at things that we normally aren't irritable or angry or anxious about. Depersonalization, hypersensitivity or complete insensitivity to emotional material. So either being kind of too emotional when you're seeing something or sort of feeling numb. It could go either way, I guess, at either extreme. Headaches, trouble sleeping, exhaustion, emotional exhaustion that I think we all probably experienced at some point. Although it could be physical exhaustion as well. Weight loss can be associated with it, impaired decision-making, problems in personal relationships. People sometimes start to isolate, kind of like a poor work-life balance, diminished sense of career fulfillment. So that could be like if you're a nurse or a doctor and you start to lose, kind of like the passion for it, then that could be part of the compassion fatigue that's kind of going on. Feeling like a failure, self-doubt, powerlessness, secretive addictions, self-medicating, and hopelessness. Like, you can feel some sort of like sometimes a sense of hopelessness in humanity, I think. If you start to, depending on the environment and the situation, you really kind of start to kind of take that on.
So the self-medicating piece is always something that we talk about with addictions. Always. Yeah. But if you don't recognize it, it must be a lot easier to do the self-medicating if you're not recognizing the compassion fatigue.
Yeah, for sure. People sometimes just want to feel better. And again, if you're not able to identify what's going on and maybe get into therapy or get some other support, then, people may go to drinking or smoke or, using marijuana or what have you as just some kind of relief or release, or shopping, a variety of different food, variety of different addictions to feel better.
So I noticed, this is a silly question, but I noticed you said you can lose weight. Can you gain weight also? Can you be?
I would imagine.
Just think that's interesting.
Yeah, it's not on the thing from Sam Show, but I would imagine if you are, if food gives you comfort and you're feeling that way and you're eating food, then I would imagine it kind of goes both ways. Lose weight or gain weight.
How does compassion fatigue affect the brain?
So that is a complicated question that it's not my strong suit. So I don't have all of the answers for that, but there have been studies done. And again, I don't have the studies off the top of my head that it does affect chemicals in your brain. So that there's sort of science behind that things are changing when you're experiencing this. It's not just, there's proof behind that. But in terms of specifics, it's so in depth and hard for me to comprehend. I can't relay that back to you.
Well, what I remember is Pat Opes, when she did our grief and loss podcast, talked about the grief brain, mm-hmm. and how there is a physical reaction to this mental stress.
Yeah.
Loss. So is that what you're
it's similar, and I don't think it might not affect the same brain parts. I really don't know too much about grief brain. And again, that's such a difficult, just for me personally, to remember and to comprehend. But it does affect your brain in a way. Like there have been studies done on that, and you can kind of see that. So something is happening physically.
So are you going to tell us how we can help ourselves get
sure.
better?
So I want to
keep that secret, huh?
The secret. I definitely, that was, I think, a really big part of this. I wanted to touch upon some definitions and then talk more about healing and being proactive. I think being proactive with so many things is so important. But another kind of quote or another thought is, to refocus ourselves from other directed to self-directed. So again, focusing when we're going through this, focusing less on others and more on ourselves to rejuvenate ourselves and to heal ourselves. That's important.
Can I just interrupt you there, Barbara?
Sure.
That is probably the hardest thing for people that are most likely to suffer from compassion fatigue, because they're givers.
Absolutely.
How do they have to readjust?
Absolutely. I mean, the people I've worked with, they kind of do this kicking and screaming.
Okay.
Kicking and screaming. It's not something that fits for them. And so, but you really have to break it down. To take care of yourself is the best way to really take care of others. It's just, that's the way it is. You have to keep yourself at 100% so that you can give to other people anyway, or you're just going to wear yourself out and not be able to give. So it's kind of like a goal. You want to help other people. Well, you have to be able to help yourself as well and keep yourself healthy. And so that's kind of like a mutual kind of goal. It's a mutual goal. But people have a really hard time with that, unfortunately. So I think it's step by step. It's not optional though. Like, so self-care is not optional. It's
That
really
is a great line.
essential.
I mean, how many people, I've never heard it said quite like that. That is perfect. It's not optional. I'm writing that down myself.
It really is essential. And so, and to just be able to continue to do the work that you do, whatever work that is. So we talk about basics, right? Getting enough sleep, right? Proper nutrition, exercise, taking care of your basic needs is a starting point for this, is like, the foundation of that. And that I don't, sometimes I forget to say that to people, but that is your foundation, so that is something to start with. And then, like I sort of said, being proactive, individualize your self-care activities and do them often. Something that I thought was really cute. So I don't volunteer so much with animals anymore, but I used to with cats a lot. And I still see things. So things cross my path every once in a while. And there's this cat who was really horribly harmed in some way, and he was in the hospital for a while. And he got released from the hospital after being in there for a bit, and they had balloons. I saw this online. They had balloons, and then they celebrated and had a cake. This wasn't for the cat. The cat got treats and wet food and was happy. But this was for the people that volunteered. This was to celebrate their efforts and to take a pause and celebrate. He has a long journey. His name's Lord Thomas Stanley, or Stanley Thomas, if you want to look him up. I'm sure you can donate to him. But he has a long journey in his healing. But this was to celebrate the small victory that the volunteers had, and that he was doing a little bit better. And so I thought that was great.
That's just reminding me of when you would see some of the COVID patients released from the hospital, and the long lines and the clapping and the. Exactly.
Yeah, absolutely. Celebrating people, celebrating small success, because it's never small. People think it's small, but any success is great. Other parts of this is setting boundaries, and setting boundaries could be a whole other 5-hour podcast, but really that's important in life. It's definitely important in this type of work, or when you're, if you're at the point where you're feeling that compassion fatigue, setting boundaries. And that's something where I wrote myself a little note, that's something that I'm a therapist, so of course I'm going to be biased, but I would think that would be something to work on in therapy. There are plenty of good books, but to be able to really take that, if somebody's having a difficulty setting boundaries, to do that in therapy, to learn that skill. It's amazing how I think your life can change if you learn that. So that's important. I've heard of respite days. So if some volunteers or workers will take off like a day, take off a day. I don't know how often they need, I guess, and get off the grid, put the cell phones away, put, all of the social media away, and just sort of reflect, take a time for self-care, but reflect on, why did I get involved in this work? Why did I start this career, get involved in this volunteer work? How can I renew my sense of purpose? That's always good to just sort of reflect on that and reset. And I have some other ideas here too. So an individual self-care plan is sort of like a template you can use. You can include some time for yourself to reflect on your needs, your values, your hopes. Find a place with no distractions, no phones, things like that. You can do meditation, breathing exercises. The internet is a huge resource for free stuff. So free meditation, guided meditations, or breathing exercises, or free yoga even. Whatever, again, these things are individualized, but the reason why people talk about meditation, yoga, and things like that is because it quiets your mind, and that's the point, is to sort of quiet your mind. But if you wanted to go sit in a park, that's fine too, or just be at a quiet place. It's going to have a similar effect than if you're doing, yoga or meditation. And then to just continue to renew that plan, and change things as you go. And really, I think a lot of it is, again, individualized, but a lot of it is also the commitment. That's the piece, the proactivity and the commitment to taking care of yourself.
You know, Barbara, I don't want to get off track too much, but I'm imagining that, well, I guess, talk about burnout. My one issue is meditation doesn't work for me because I don't know how. And then I get frustrated because I always want to do everything right. And I can't meditate to save my life. So I'm imagining here I am weighted down with a job. Okay. But when you're really these people who are in compassion fatigue, they're weighted down by much more serious stuff.
Mm-hmm.
So if I can't get there, how do they quiet their minds? Because they must, I mean, no wonder they can't go to sleep. I can't imagine.
Yeah. I think it's, you don't have to do meditation. Like I was sort of saying, I think it's just, gradually taking some time to reflect. If that journaling, meditation, I think is, I mean, obviously that could be so in depth, and for some people it's hard to get in that spot. Right. But if you can take 5 minutes to sort of silence yourself, or 5 minutes to do like a deep breathing exercise, it just helps recenter you. And that might be, make a world of difference in the beginning. And then as you move forward, you might be able to sort of add on. I think you can add on and build onto that. I took a training on Zoom with this Dr. Deborah Alvis. You can probably look her up. I don't know if she has books and stuff, but she might. And she had stopped, like throughout the training, she would stop and do sort of like a little activity to sort of just, it was a training on compassion fatigue, but she would stop and just sort of force us to take a break, essentially. And wow. Some of those things weren't that, I mean, it wasn't that hard. It was sort of like, close your eyes and feel your feet touch the ground. And it was like a grounding exercise. I actually have 2 of them. These are from her. I'm quoting. So, but I have 2 of those examples that we can finish on if you want when we're done, and I can just read them just to get people started.
Absolutely. So how do you deal with compassion fatigue when it's somebody you love that you're seeing is suffering from what you would assume is compassion fatigue?
That's a good question. I mean, I think it's good to, if you have the knowledge, your friend or a loved one, you can talk to them about it, and just sort of, again, some people don't have a definition for it, and so it's confusing, but just kind of letting them know, hey, there's something out here, and you might be experiencing this, giving them that education, and then having them kind of explore that further. Again, I'm biased, therapy is great, and I think that's important to sort of be a possibility. If you feel like you can't do something on your own, and a person's really struggling, and they're watching their family member do that struggle, I think it's not, it's important to remember that you as their family member might not be able to particularly help them, but you can give them resources that could be helpful. Right. It'd be hard for a family member, I think, to help out in that way. They could support them, like any other way, kind of support them.
And then I guess the other thing that I think about are, we tend to collect friends that are like us. Mm-hmm. So now you've got 5 very close friends that are all in the middle of compassion fatigue. Do they start a support group, or do they, because they're all in the same place. So how can they pull each other out?
I think that's a good question. I don't know, because that could be a very healthy support group on one hand. It really depends, I guess, on the people. On the other hand, it could be something where everybody's kind of commiserating and right. Nobody's finding solutions or healing in that. So right. I feel like it sort of does depend on the people involved. When I did a workshop, I did remember I did that right before COVID, that workshop right. for animal care workers and volunteers. A couple people came, and some of them knew each other, some of them didn't. The people who knew each other seemed to be very connected and they kind of were able to, they did the same type of volunteer work, and they were able to support each other. They joked a lot. They laughed. They laughed the whole time. You know, they had fun with it. And that stood out to me because I thought, oh, wow, they have a really good support system, where they can kind of, they're relating to each other in a really healthy way. But I don't know that it would always be like that.
Right. And how can you break that cycle if you're with a group of people that were all complaining about the same seriousness of the fatigue? Is that, I mean, how do you break that cycle? Because they're your friends. You want to be with them.
Mm-hmm. Like if you're saying if somebody is feeling it's a negative experience for them.
It's not, it's the only thing that connects them is the compassion fatigue.
Oh, okay. Yeah. I mean, that's a good question. I think it'd be important for them to sort of be honest with themselves, and maybe if it's not healthy for them, it's not helpful, to find a way to set boundaries, to keep themselves emotionally kind of safe from that. So not to, they might not want to stop talking to them or not be a part of their lives 100%, but they could find a way to protect themselves. And I think that definitely goes back to boundaries. I didn't mention this, but when we talk about boundaries, it's sort of like physical boundaries, emotional boundaries, sexual boundaries, mental boundaries. You know, the boundaries there's a variety of different boundaries you set. And sometimes you have to, I tell my clients, you have to put up that emotional invisible shield to sort of protect yourself. So for example, you know, if you're having a really tough day at work, let's just say, and you're sort of exhausted and you're just looking forward to coming home and hanging out with your cat and watching a movie, let's just say, and that person calls and it's draining on you. That person who's calling is draining you. It's okay not to answer it. It's okay to put yourself first and get back to that person at a different time when you're feeling a little bit better. Some people don't realize that it's okay not to do that. So to protect themselves.
That's interesting because for some reason nowadays we all think when the phone rings we have to answer it.
Yeah.
Or the message that comes through. I always love that family member that will say to me, don't you check your messages? Not yours. So what I'm hearing from you are boundaries and self-care.
Mm-hmm.
Meditation. So I'm just reacting as I would react. They're all really tough things for overachievers, for compassionate people. What other things? I mean, I'm hearing different kinds of boundaries and stuff. What are like some 3 simple things that we could do right away with this?
So something simple. I mean, I think that I really do feel like those things it's really important to, like we talked about before, sort of like really set a routine for yourself and really try hard to practice these things as much as possible. Again, it doesn't have to be particularly meditation or yoga. It could be whatever works for you. Massage, you know, it could be whatever it is, sitting in a park, going on a hike, taking your dog for a walk. It could be whatever, you know, so calms you. But I think a little take home, if you will, is, you know, making sure to do at least one thing for yourself that's healthy or that makes you happy a day. I would say that's a good start. There are things online you can find online, like 100 self-care activities. And, you know, they say like reading a book or going to the beach or what have you. Some people like to use them as and pick one, you know, and do that for the day, or you can just choose whatever it is you like. But doing at least one thing for yourself, because I often talk to people, and this isn't people who come in for compassion fatigue, clients that just come in for whatever they're coming in for. They're not doing anything for themselves. They're not even thinking about that. They're just running and going. That they're not even that themselves are sort of like they're last. They're not thinking about it, and you can't sustain yourself that way.
Wow. Can we do the exercises or the
sure. Okay.
Talking about, because now I want to go online and get the 100 things to do for you.
I think I have it in my office. You can go grab it. Okay, so this one's called Witnessing the Breath, and again, Dr. Deborah Alvis did this as in her training for compassion fatigue. So I'm just going to read it, and then I'll do the second one. So you may wish to begin with brief centering, bringing the awareness to the breath, following the in-breath and the out breath, not attempting to change it in any way, simply witnessing. Noticing the way in which the body moves with the breath, perhaps focusing on the rise and fall of the abdomen or chest, expanding the awareness to include the body as a whole. Make any subtle adjustments to the posture to increase comfort. And when you are ready, opening the eyes. So you don't need this to be read to you. This is something that if you can think about this and sort of do it for yourself. It's just closing your eyes. You can lay down, you can sit down, you can be standing up, and just feeling, just concentrating on the breath to calm yourself down. And you can do it for as long as you want. If you can't sit with that for a long time, do it for 30 seconds and build up on it.
So that's considered like meditation? I can do
So
that?
it's called witnessing the breath. It's
Okay.
just kind of slowing your body. But I would say it's beginning of meditation, right? Meditation, involves breathing, then that's the beginning part of it.
Okay.
Starts to get, so that's helpful. I think you can do that in the bathroom or at work, in your office, close the door. I mean, you can do it anywhere. Nobody's going to know, really. You just kind of have private space. So the second one is a loving kindness walking meditation. And this is something you would do walking, I guess. It's taken from, she said it's adapted from Salzburg, Loving Kindness, The Revolutionary Art of Happiness. So just so you know, that's where it's coming from. So begin a walking meditation using a normal pace, directing your personal loving kindness mantras towards yourself. As you encounter others, keeping in mind that these beings could be human, animal, or plant life. Silently offer them loving kindness. Alternate between sending others loving kindness and directing that loving kindness towards yourself. This meditation can be practiced in a variety of settings, standing in line at the grocery store or bank, while pumping gas, in an airplane, or in a physician's waiting room. This meditation strengthens our connectedness with other beings while strengthening our own capacity for loving kindness. I chose that one because I don't think we are kind to ourselves a lot of times. So, I mean, hopefully you are, but I don't always see that. So I think that that's a good meditation, and a mantra is just something that you could say to yourself. It's a thought, it's a belief, it's a value. It could be a sentence. You can look up online if you're having a hard time finding one, originating one for yourself. But it's something that is a positive. It's something positive in nature. And so that was saying sort of cultivating that within yourself, and then cultivating that with anything you're coming in contact with during your walk or wherever you are.
Well, this was really helpful. Now I'm thinking maybe I can do meditation. So you
See?
solved my problem. I hope you're solving everyone else's problem, guys. Compassion fatigue in themselves and in people they care about. Is there anything else you'd like to add, Barbara?
Yeah, I just, like to mention, hopefully sometime soon, Loretta, you and I will talk about it. Work, I like to do sort of like a donation based only, and you don't have to donate if you don't want to, but workshop for animal care workers and volunteers. And that's what I like to get started with. And then we'll see if there's room for other types of workshops, maybe designated to nurses or medical professionals, doctors, or therapists. I leave them out, but I am a therapist. Any type. I think it needs to be somewhat structured with the population, because I think we'll be all over the place if not. But if there is a need for that, just let Loretta know if you'd like that. But definitely keep an eye out on the animal workers and volunteers workshop coming soon, hopefully.
Absolutely. We're starting to open up. Our groups are coming back. But it's hybrid, I will admit. We have some coming live and some on the screen. That's why we have the big TVs in all the group rooms now.
Okay.
Well, thank you all for joining us. And Barbara, thank you so much. I think I now know the difference between compassion fatigue, and burnout. So thank you.
You're welcome.
Thank you all for joining us.